I want to give a brief update about the pandemic, COVID-19. We started working on this issue back in March. Unfortunately, Carmel's had to cancel a lot of events that are very special to our community. The Christkindl Mark, Oktoberfest, Arts Festival. And it was hard to cancel these events, particularly the Christkindl Market, which I helped start and has been such a success here in Carmel. But we knew we could not conduct these events safely with the numbers needed that the organizing groups needed to break even and make money. And we didn't want the community to remember a less than ideal experience either. So we're going to take a year off. But then we'll be back in a year to do these events again, better than ever and more fun than ever. This was a tough decision for me, but I think it was the right decision to keep our community safe. We unfortunately had to close the city, in essence, for business. We did it about a week ahead of the state of Indiana, based on data that we're receiving from our hospitals and the health department. And it was tough on our small businesses to see the entire city, in essence, shut down for a period of time. But the good news is that Carmel got its unemployment rate for the month of July just a few days ago. We're down in the 5% range. Throughout my lifetime, 5% has been more or less average. We were at 2% in February before the pandemic, but 5% is good, and I believe that we're making progress with reopening our economy. We've also done well with COVID compared to other places. We could always do better. The community has been doing things that limit the spread. First of all, we've been testing all of our city employees since the first week in April on a regular basis. And this is important because we have EMS personnel in the fire department that take people infected with COVID to the hospital in ambulances. They provide first aid on the scene. So the positivity rate among our workforce has been higher. But because we've been testing on a regular basis, we can then ask our employees to quarantine when they're positive, and we can do our own contact tracing within a few hours through our fire department to see who else needs to self-quarantine. As a result, our city employees and their dependents in our health system comprise almost 2% of the city's population. So that has helped, I think, hold down the infections. We worked with local labs to provide quick turnaround times on testing at sites in Carmel. That has helped as well. The community has come together. We all make mistakes from time to time and forget to wear our masks, but overall, the community has come together to wear masks, to wash hands, to follow good hygiene. And as a result, we have lowered the positivity rates in Carmel, and we have lowered the deaths and serious illnesses among our elderly and other people with comorbidities that are most at risk for COVID. I'm optimistic that we will have a vaccine. We're at least on track to have a vaccine by the end of the year, perhaps sooner, and that's going to be the real answer. We can get through to then by working together and taking care of our neighbors. Remember, you're not protecting yourself as much when you wear a mask and wash your hands on a regular basis. Physically distance yourself from others. You're protecting other people in case you may asymptomatically or pre-symptomatically be carrying the virus. We've done a good job in Carmel. We can continue to do it for a few more weeks. We'll have a vaccine, and the whole future will be in front of us. I'm very optimistic that we're at the tail end of this challenge. And I was talking to a World War II veteran who's 97 recently, and he quickly pointed out to me, the United States has been through a lot worse than this, and we made it through just fine. We'll make it through this pandemic too.